Lady yields back. The chair now recognizes Representative Pallone, the ranking member of the full committee, for 5 minutes for questions.
Thank you, Chairman. You know I respect all of you on the other side of the aisle, but I am so frustrated because I really don't know how we proceed here anymore. The ranking member criticized Dr. Fauci, who I greatly respect and think was one of the best things we had during the COVID crisis, okay? Chairman Griffin said that President Trump's statements were an error, but the president doesn't admit his errors. Many of his supporters continue to insist that COVID was a conspiracy, vaccines shouldn't be taken, masks shouldn't be worn, schools shouldn't have been closed in certain circumstances. I don't know how we can make an improvement at the CDC when we fundamentally disagree on almost everything that happened during the COVID crisis. We talk about data, and I'm going to ask you questions, Dr. Benjamin, about the data. But the bottom line is that we look at the same data and come to totally different conclusions about what to do. So I don't know where we're going here. I mean, I love you all on the other side of the aisle, but I really don't know how we proceed when we have such disagreements over fundamentally what happened during the COVID crisis and how to deal with it in a new way. I just don't see it. I'm an advocate for vaccines. I think everyone should take the vaccines. I think that COVID was real. I think masks should have been worn in many circumstances. I think some schools should have been closed. I just don't know. And the chairman, Woman Rodgers, it's just so frustrating because I don't know how we can proceed with such a disagreement on everything, even though we look at the same facts. But in any case, let me ask a question. Everything that the CDC does depends on good data. It needs to have accurate, timely health data from state and local partners to determine an appropriate response to health crisis. It informs the guidance that CDC will put out to support state and local healthcare institutions. So the data has great value for the CDC and health officials across the nation. But at the same time, through reauthorization of the Pandemic and All Hazards Preparedness Act, Congress has the opportunity to support sensible reforms and further ensure that our nation's public health agencies, including CDC, have the necessary authority and resources to respond to future threats. So let me start out with Dr. Benjamin. I have two questions, if you can do them both in this whatever time's remaining here. How would better data enable CDC to keep up with persistent health threats the nation faces? And secondly, would giving our health institutions like CDC and FDA broader authority to address issues like drug shortages and data transparency help our pandemic response abilities? Those are separate questions, but you got 2 minutes.
Speed and efficiency. We missed opioids when we had, thousands and thousands of doses of opioids going into communities, and nobody paying attention because the data wasn't timely. You heard the measles story. I'm sitting at home during COVID, head of the Public Health Association. My phone rings, and the health officer in Milwaukee, Wisconsin, calls me to tell me that she has seen a disproportionate number of African-American men dying of COVID. That's how I found out there was a disparity occurring. I assumed it was occurring. But that was the first evidence that I had was a phone call to my home from a member of the American Public Health Association who wanted me to fix it at 9 o'clock at night. And that should not happen. And CDC was struggling to get that kind of disparity data. So time and efficiency, speed and efficiency are the two things you get.
And what about the authorities? I mentioned about the giving CDC and FDA broad authority to address drug shortages and data transparency.
No, I think it's essential. And I understand there's a difference of opinion there, but I think we can do it. I think we can sit in the room, we can figure out how to do that in a way that protects patient confidentiality, increases speed. Look, we give the banks a whole lot of latitude, and they have a lot of information on us. Google has a lot of information on us. The social media companies have a lot of information on us, and I know you're struggling with that as well. But I don't see why you can't come up with a way to do this. Maybe ask for a study. Put the authority in the law when you reauthorize the law, but require some kind of study in order to understand how best to implement that before it gets implemented. I don't know. But
Well, you're a lot more optimistic than I am at this point. I got to be honest with you about our ability to come together and address some of these concerns. But
we
hope
don't
springs
have a choice.
eternal.
We don't have a choice. And I'm just going to, to argue here today, we have to solve this. We cannot wait. People are dying, literally, while this is happening. Because we don't have the numbers, we don't have the data. And I think I can see a solution here. And I can tell you that there are many of us who will be eager to sit down with you to try to figure that one out.
Thank you. Thank you so much. I yield back.
Gentleman yields back now, recognized